Thank you very much for the invitation. I'm delighted to be here today. The University of Brighton, where I work, is long been collaborating with the Centre for Sustainable Healthcare for many, many years now. And when I was asked to do this talk, I was trying to remember when I first heard about the SusQI, and I looked it up because it was so many years ago, I couldn't quite recall the exact date. And I think it was 2018 that Francis Mortimer presented the SusQI at the SHARE conference that you've just mentioned. So we've been collaborating with this conference for several years on the CSH. And I remember when Francis first launched it and the publications that came out at that time. And I think for a lot of us that have been working in this space for some time, it as a framework just provided this scaffolding and this language and this way of being able to translate sustainability concepts into easily digestible, communication and project planning for those of us in healthcare education, clinical practice or research. And I think that's exemplified in the program today, that there's the teaching element of, using SusQI as an educator, because that's my main role at the university. But I've certainly also been part of and supported students and look forward to seeing other applications of it today in terms of clinical practice. And we're also using it more and more in research studies. And I think as a tool, I think the legacy of it growing year on year, the framework essentially is the same as when it's launched. It's, the core essence of it, I think, speaks volumes about just how translatable it's been, but just the application of that seems to grow every single year. And the showcase event that, has grown over time as well, really exemplifies just the success of the framework. And I imagine people coming today know about it or been using about it, but if you've come and haven't heard about SusQI and are learning about it for the first time, I'd really encourage you to check out the SusQI website, which has got fantastic resources, and certainly in our University of Brighton practices has been a really useful resource. We're now using it in nursing, medical, physio, podiatry, radiography, and occupational therapy health courses. That's in terms of teaching. We're encouraging our students to be using it within their assignments. And I can think of several examples in recent years where undergraduate and postgraduate students have been using the SusQI framework. And we now have a PhD student who's based her PhD research in primary care and digital health around the principles of the SusQI framework. So that's been really exciting to see doctoral students also embracing this as a framework. Another thing that we've done at the University of Brighton is used it ourselves in terms of our operational practices. And so we did a greening up our simulation rooms project. So we got our students involved at estates and our technicians that are leading on setting up the simulation rooms and dealing with the waste management and procurement that involves buying the supplies that we need for our simulation-based education and OSCEs and things like that. And the SusQI framework was just a really helpful way to plan a project that was about greening up our own institution, because we realized we were teaching it for many years, but then we needed to lead by example and green up our own practices in simulation. And we've had some collaboration as well with other institutions, including King's College. I noticed that Jocelyn's here today speaking, and so we've done some presentations together and workshops together. So, this sort of interest of SusQI embedded into simulation and that aspect of education is another opportunity for collaboration with other institutions, because we're all trying to do the same thing. Much better to work together on it. As mentioned in the introduction, I was leading a national project that we just undertook very recently, which the CSH was a partner organization in as well, called the Intensive Care Environmental Sustainability Recipe Book Project. So even if you're not from an intensive care background, much of the principles in the recipe book are applicable to anywhere in healthcare. And it's a collection of recipes. So each recipe has the ingredients and methods on how you can green up for a particular topic. And of course, in the quality improvement recipe, we embedded SusQI as a key resource. So delighted to be here today. I'm just doing an introductory talk, so I'm conscious of the time. I keep looking to my clock. And I just wanted to say that I remember several years ago, I can't remember when it was exactly. I feel like it was during the pandemic time when we all kind of launched into Zoom and Teams. There was a SusQI webinar, and Kay Leadham Green, I don't know if Kay's here today, many of you will know her. She made a really powerful statement that's always stuck with me, that All quality improvement is SusQI. Even if you don't recognize it as such, we're all trying to improve patient care, maintain quality, improve quality, but do so in a way that we can financially afford it. It's not harming the planet and is also socially responsible. So I'm really looking forward to today's presentations, and I can't wait to learn more myself about some of the projects. And please do come along to the 20th of June to the SHARE conference that the CSH is a partner organisation in, and can hear even more SusQI projects. So thank you very much, and I hope you all enjoy today's event, and looks like a fantastic program. Thank you.